So let's get to the last, definitely not the least, the last presentation of this morning. Now it becomes this afternoon. Professor Nancy Lau. Professor Nancy Lau is in the Faculty of Education at Hong Kong U, and she is the founding director for the Center of Information Technology and Education. So that title is a natural transition from the previous talk to the next one. So let's welcome Nancy.
Thank you. Thank you very much for giving me an opportunity to share some of my thoughts about post-COVID-19. And in a way, I think the title of my talk, Preparing for and Surviving the Next Global Calamity, probably very well captures the kind of focus for at least the morning's discussion. And I think we are also at a very appropriate time when to talk about this, because in Hong Kong now we have the pandemic at least sort of seemingly under control. So this is really good. So what I'm going to talk about is what is a global calamity, why should we be expecting another one soon, and consequences of global calamities, as well as, the focus is very much on disaster preparedness and how we can, so what is disaster preparedness and what we can do about this. And first of all, I have to declare my own personal interest. I am a learning scientist. So I see the world in terms of learning. So when things don't work well, I would ask, so what haven't we really learned? What's our problem of learning? And so our solution also lies in trying to learn. Okay, so what are disasters? Disasters are events that cause serious damage, destruction, and loss. And we have natural disasters like hurricanes, earthquakes, flooding, and volcanoes, and so on, which are not sort of unknown to us. And we also have technological disasters such as explosions, chemical leakages, radioactive leakages causing huge, damage. And we also have man-made disasters. And a very prominent type of man-made disaster are terrorisms. And unfortunately, we see too many of them, and in many parts of the world, Hong Kong included. And we do have other disasters which are not totally man-made. They, in a way, they evolve, they emerge in the community, in the world, but they are also very much connected with the human conditions, particularly with urban populations increasing and hygiene conditions and so on. And of course, it's not only humans, it's also animal diseases, which are also a challenge to us, both in terms of food and in terms of health. So what differentiates a disaster from a global calamity is the severity and the scale. And the making of a global calamity are disasters that spread. And this morning we heard from Professor Cowling talking about the story of the king and the rice. Is similar. So it's not just spreading, but if we see, say, this is the chain reaction caused by falling dominoes. And we can see that, say, the first domino is only 5 millimeters in height and 1 millimeter in thickness. But by the third, and then each subsequent one is 1.5 times taller than the previous one. But by the 13th one, in this picture, the last one, is already 1 meter tall and 45 kilograms in weight. And if we continue this to the 29th, then that domino would be as tall as the Empire State Building, which is 380 meters. So when that happens, that would be a huge disaster. When can we stop it? That's the question. If we stop it early, it's nothing, just a tiny domino. But if we don't catch it in time, the effect is phenomenal. And this is what we see. So COVID-19 is one of these types of global calamities where it spreads. And we have other calamities like the bushfires, wildfires, pollutions, they spread and they accumulate. And the worst feature is that these are very difficult to detect until it's often too late. So when we see the ice cap disappearing, in fact, things have been at work for decades or more. And then ice caps are easier to see. You can see them receding. But for things like permafrost melting, then in fact, once you see it, it's already, you can't do anything because a lot of things have happened under the ground. So why are we seeing more and more frequent, more destructive global calamities? Well, because of the cascading effects. So we have expanding impacts through the ecosystem, such as climate change. And we also see cascading effects on interdependent ecosystems, such as, so say for example, we have wildlife interacting with farm animals and then also with humans. We also have, say, epidemics, which have a direct impact on health system interacting with cultural, economic, political, and technological systems. So the consequences, well, we have primary consequences, which are loss of life and property. And the second is even more widespread, more pervasive, and more long-term. These are loss of homes, disintegration of social fabric, social unrest, civil wars, international conflicts, humanitarian tragedies. The list goes on. So how can we mitigate disasters and global calamities? Well, we know about this exponential curve. So in order to mitigate, we need early detection and so we need methods of identification. So flattening the curve is well known. So we need to be able to flatten it until it's below the capacity of the healthcare system. Otherwise, it would disintegrate into chaos. And so we need early isolation and early treatment. But isolation and treatment is only one part of it. Human beings are social animals, and we build our whole society on the social fabric, on connectivity, and we need to meet and we need to work together. And so during periods of isolation, we need to circumvent the isolation. We need to build alternative connections. And so that's why we have learning at home, working at home, and so on. And although we've been trying to manage, but how effective are the alternative connections really affect how well we can actually mitigate these cascading effects of the isolation. And the goal of these alternative connections is to maintain well-being, essential production services, emotional well-being, social well-being, long-term individual, social, economic, and cultural well-being. So in terms of preparedness, very simply, we need to be able to find and control pathways of connectivity, but we also need to circumvent isolation. And I see, as I said at the start, I see this as a learning challenge. So one part of the learning challenge is on detection and isolation. At which point can the chain reaction pathway be detected, and how can the isolation be effectively implemented? The next is how the next learning challenge, which is even more challenging to me, is how do we build alternative connections that work? So which cascade chains must be effectively deployed? And so you might be asking, why am I sort of talking about, in terms of mitigation, also another kind of cascade? Well, simply put, if we can't build a cascade, if we can't build an expanding connection which can mitigate the isolation, the damages is difficult to control. So before we go further, I would like to talk a little bit about what do we mean by learning and how does learning happen? And when I talk about learning, it's not only the individual, but also communities, groups, societies, and also humanity. So, but coming back to the individual first. So learning is change. What needs to change? The brain needs to change. We learn something new. We know that the brain connections change. But say the muscles would have to change. They have to grow and develop differently. And then we need motor neurons. And the learning is not just those directly impacted parts. Actually, the whole body needs to change. So if you were to become a good dancer, you need to have a fit respiratory system, a fit circulatory system, and so on. So, and then all these different systems need to be coordinated, otherwise it won't work. So what are the conditions for this kind of learning? Well, we need the right infrastructure for training, for learning to take place. A lot of times we not only work in isolation, we work with others, we dance with others, and then we also need coaches. Of course, a lot of us who are arts fans are looking forward to the West Kowloon Art District because we learn better, we do better when we are able to learn from each other locally and internationally. So did we learn something from SARS? Well, first of all, I would say we paid a lot of fees during the SARS period. A total of 299 people died during the SARS, and this is a hefty amount. Did we learn anything? I would say yes, fortunately. So we have built very good sorts of science laboratory. We have excellent teams of scientists, microbiologists. We have an excellent healthcare system. And we also have engineers who help us to understand how buildings work. And then we also have new knowledge, skills, and behavioral changes, even in allied professionals. And of course, we learn also in terms of changes at the policy, regulatory level. And so we have changes in the hospital authority, public health departments, even medical information database, and the immigration department, and so on. So all these are necessary. And all these, I think, we learned from SARS, which helped us during this COVID-19 period. But the learning is not just at the professional, scientific research levels or even policy level. Very importantly, we need learning at the community level. And these pictures were taken during the SARS period. There was no legislation then, nor now, to require people to wear masks in public. But people have been very conscientiously doing it of their own. So this is very important. We're not only doing it in public, we even change our way of living and working and behaving everyday life. So when we talk about learning, we need to learn about detection, isolation, as well as alternative connections. What I would like to focus more on now is to consider learning at the community level. How do we do these two kinds of things? And I draw inspiration from the work of Gareth Jones. He has a book called 10% Less Democracy. And he said the Western world would do much better if we can trust elites a little more and the masses a little less. What does it mean? There needs to be trust for the right kinds of things. And we need to build trust for multi-level aligned learning across sectors of the community. So that means we need deep cultural changes to build this trust. What is needed to build this trust? We need respect for science and evidence-based decision-making. So at this point in time, Hong Kong is very fortunate. We have our scientists, we have our healthcare workers, we have our public health officials, all giving aligned messages grounded on scientific findings and facts. So this helps us to have coordinated, aligned public sorts of behavioral change. And it also requires transparency and communication. So the fact that every day we hear from the government actual figures about infection, where they are, why do they happen, which are community sorts of infections, which are imported infections, and so on. So with these transparency and communication, people can build trust and build confidence in being able to know what next to do. So how do we build a so the research requires, how can we build a sustainable research and knowledge exchange infrastructure and channels of interactions in the interest of well-being? So coming back to my own area, educational research. So what do we mean by preparedness in educational research? We just launched the Wave 1 findings of our project on learning and assessment for digital citizenship. The data collected that was reported here was in fact collected exactly 1 year ago. So that means it was before COVID-19 started. And what did we find? We find that generally students have some basic digital literacy skills, but they are not really having advanced skills. They actually don't use technology much for learning, either at school or at home. And then we also find that there is a huge digital divide across schools, between individuals, across schools, and within schools. So what do we mean by digital performance divide? We have, say, for example, one school where the primary 3 students outperform the students in another secondary school at the secondary 3 level. And then we also have divides in digital access. We have about 10% of the students surveyed who have no access to digital devices at home beyond a smartphone. So that means they cannot have anything like a laptop, desktop, or a tablet. Okay, so, and there's also divide in terms of family support for digital use or digital learning, even including, say, digital safety, or say how to handle or recognize cyberbullying. So if this happens, if that was before COVID-19, now that we have 3 months of online learning, and at least 1 more month, I would say, as far as we hear, then during these 4 months of online learning, what would happen to our students? Well, if nothing is done, I would predict that the digital competence would increase. And not only digital competence, it's actually academic performance would be hugely affected. And so we have some who would be benefiting, who are still learning very well, but some who will be lagging even more behind. And with this increasing device, there would be sorts of chain reaction effects, cascade effects on other issues like getting, say, the opportunity to get into university or to get jobs and so on. So this has huge reverberations. Can we do something about it? Now, we did provide some suggestion on what is needed. And in fact, we really hope that there could be research that actually looks at what is the impact now on students. How are students learning? How are they feeling? How are families coping? We have different sort of reports and images, some positive, some very negative in the community. But what is the real picture? If we don't detect the things right there early on, it may be too late for us to do anything. And even just this kind of sorts of research that I was mentioning, they are necessary, but they are not sufficient, because in order for the whole set of issues that would ensue from here to be addressed, we can't just look at education alone. And even within education, you have different levels: schools, classes, teachers, students, families, and so on. And then we also need the community. And so I would say we need to design a learning epidemic. What do you mean by designing a learning epidemic? Well, the learning can't be just young people or students. The whole community needs to learn. How do we do online learning? What is good online learning? What are the necessary conditions? And how can we connect communities and provide support and so on? So we need a learning epidemic that spreads good and positive ideas. And we also need to build on and leverage proven principles of learning. So has learning epidemics ever happened in human history? Yes, we know about them. They are just so quick, it's just like wildfire. But unfortunately, these are learning epidemics of distrust. So this would not be able to help us to solve the problems when we need to build alternative connections for global calamities. Fortunately, we also have examples of learning epidemics of trust, which are built on culture and extended experiential learning. So the challenge to us is, can we build this kind of learning epidemic? I want to end my talk by sharing an interview that was done in 1959. I believe that was the last interview of the great philosopher Bertrand Russell.
One last question. Suppose, Lord Russell, this film were to be looked at by our descendants, like a Dead Sea Scroll in 1,000 years' time. What would you think it's worth telling that generation about the life you've lived and the lessons you've learned from it?
I should like to say two things, one intellectual and one moral. The intellectual thing I should want to say to them is this. When you are studying any matter or considering any philosophy, ask yourself only what are the facts and what is the truth that the facts bear out. Never let yourself be diverted either by what you wish to believe or by what you think could have beneficent social effects if it were believed. But look only and solely at what are the facts. That is the intellectual thing that I should wish to say. The moral thing I should wish to say to them is very simple. I should say, love is wise, hatred is foolish. In this world, which is getting more and more closely interconnected, we have to learn to tolerate each other. We have to learn to put up with the fact that some people say things that we don't like. We can only live together in that way. But if we are to live together and not die together, we must learn a kind of charity and a kind of tolerance, which is absolutely vital to the continuation of human life on this planet.
So I hope we can build or design learning epidemics that build long-term resilience, a fast, effective response that are grounded on science, love, and compassion. So that's at the end of my talk.
Thank you, Professor Low. Provided a wonderful transition this morning from science to technology to big data and to social science and philosophy. And so I having summarizing some questions, which is Hong Kong, University of Hong Kong, and also not only Hong Kong U alone, the universities in Hong Kong has been using online education and learning for a period of time since last year. So what kind of information or lesson we have learned in this process? What kind of experience or data we have collected that will be informative on learning and teaching in general?
Well, I think in a way, I don't know. I know, say, everywhere in the world, not only Hong Kong, people, in the area of education as well as outside of it, are very much wanting to understand what is happening out in the field. And in our university, we have actually done quite a lot. I mean, a lot of colleagues have done excellent work in terms of pioneering using different means to do online learning, because we've been very much an on-campus university. So to really be doing all our learning and teaching totally online is new to us. And many of us are sort of stepping up to face the challenge. But not everyone is having the interest or confidence to do it. And so I think at this point in time, we need to be collecting different kinds of information. And in fact, I was talking about the learning epidemic. It's not true that we don't have good practices and new knowledge, new ways of doing things, and even new technology. I was so impressed by the some of the things that I could understand that was being described. Say, for example, the big data, being able to help us to connect to different pathways and so on. So I would say if we could actually collect the information about different usages and build connections with people. It's not just the information. Information don't act by themselves. So can we connect people with information and with each other to actually spread the good practices?
Yeah. Most education institutions around the world just start to shifting to online learning in the last 1 or 2 months. But Hong Kong U has been doing online learning for many months. So Hong Kong U is actually leading at the leading position to summarize the experience and share the experience to be a leader in online education and learning. So one of the questions coming just from the audience, shouldn't we be using big data to quantify and measure the efficacy of online learning? So I literally reading out the question.
Right. Well, I think big data is something that many of us have been thinking about, but what constitutes big data on efficacious learning? That's an important thing. And do we have such data? Well, I think we have some. For example, now that we have the DSE going on right now, that data probably would provide us with some image about, whether, say, this batch of DSE students, would their performance in an absolute sense be comparable to or different from previous years. That give us some sort of signal. I was predicting performance divide enlarged. So do we see that? I mean, that's one kind. But then that's only the DSE students. What about the other students? And also so I think it is a very important and significant research question to even say, okay, which are the data, which are the big data, which are the existing data that we can get some clues to, and which are the data that we need to collect extra. So that's also one thing that we've been thinking about. Yeah.
Yeah, this is a great opportunity, and it's not we were seeking for this, but it just came upon us. This tremendous amount of online learning happened in the last several months, and presumably in the next period of time. And this will provide opportunity to study and what's the effectiveness or lack of effectiveness of online learning, which probably will be transformative in the next 20, 30 years. And it changes the way we learn, and it changes the way we organize research and education institutions. So thank you for the presentation, and it brought us many questions and opened our vision in terms of learning. Thank you very much.
Thank you.
So I will take this opportunity to thank all speakers this morning, presenting tremendous effort and progress we have made in the battle against the COVID-19, and ranging from medicine and science to engineer to social science and philosophy, and which shows the great strength of Hong Kong U in many areas of the learning and research, and also show the strength of our potential to form synergies among different disciplines. And so thanks to all for a wonderful morning, and we will continue in the afternoon after a short break. Thank you very much.